more than 12 months on and still recovering. At this long COVID clinic in Bristol, Donna is receiving physio. She has a tight chest and shortness of breath.
This isn't my voice, this is my COVID chest.
Really?
So yeah, I've got a continuation of sort of pressure on the chest and just inflammation, really.
So where would you rate yourself on there?
Donna contracted COVID-19 in March last year, at the start of the pandemic. Her GP referred her through the long COVID clinic system, but she says help wasn't easy to find at first.
I don't think the long COVID clinic's particularly visible, would be my first experience with it. Sort of myself and a friend did some research, and then he let me know that he had a referral, so I chased it up with my GP who gave me a referral. So I think particularly there's an issue with visibility.
To improve access, £34 million has now been spent to open 83 clinics across England, the first of which opened last December. NHS England says it doesn't yet have solid figures on how many people have actually used the long COVID clinics. We've seen the numbers of just 5 of the 83, which show more than 2,000 people have already been treated. Those in charge of the clinics say demand could mean the service will be needed well beyond current funding.
So we recognise that this is a condition that the symptoms can be quite prolonged. And we've already seen that from the patients who got long COVID now about a year ago. Some people are still suffering. So there is that sort of time frame to bear in mind. So that is why additional money has gone in to keep the clinics going for the course of the next year. We suspect it may need to go on for much longer than that.
We now have a clinic called the Long COVID Clinic.
In North Somerset, another referral. Louise's COVID symptoms have lasted more than a year.
Fatigue really is the main thing now. I've got 2 children, a 2-year-old and a 4-year-old. And it's just very, very difficult to get through the whole day. I've had to accept it. But yeah, it was a shock to the system.
And what I need you to do is walk on the spot for 40 steps. Okay? Ready, steady, go.
New COVID infections are falling dramatically. Left behind are the so-called long haulers, thousands who may need treatment long after this pandemic has ended. Dan Whitehead, Sky News in Bristol.